just to follow along, or in case your tablet don't work, or what?
Hard to read.
Is that a special filter you put on? Because I like to put that on my computer at work. So I know my emails come just black. I'll be like, oh, I can't read this.
I come a couple times.
I got mine to work.
Mine comes up right away.
My daughter helped me though, You got a grandson or granddaughter, don't you? Have them work with it, Russell. They'll get her figured out.
Mine didn't work either.
But he did talk to me.
Well, you got something for later that way then.
Tablet's so important, why do they give us
They
this
say
here?
the same thing.
Yeah, I don't understand.
We get wired every meeting now.
Well, it saves on the postage, I guess, but.
Or a string on you.
It's, uh-oh.
I think they probably got orders from them not to do anything about that, but I took 10 postage stamps down there.
Oh, sure, sure.
I love you.
You can't sneak up on anybody.
I want them to know
Really?
because maybe they'll all learn.
We know your department's good. We know you do an excellent job.
Oh, we just work at it and work at it.
Here and here, there.
I love you. You're good. You're great. That's great.
Seems pretty typical.
Can't mark or write notes on it.
You get a lot of radio.
They got some of those things where you phone right on.
4/10 of an inch, right?
My other one at home.
Oh, overnight, you know, yesterday afternoon, last night.
Stays on the print.
I went to a ball game in Berlin. They were play at 7. No, at 4:30. It wasn't raining my way. It was sprinkling a little bit my way.
Somebody said Princeton had 3 inches of rain.
Get started as soon as we get done.
Oh my God, do
Get
some of
off
these
easy.
go to Ruth?
No, Shardy stole them.
Oh, shit. Okay, there you go. All right, let's call the meeting to order. We'll stand
Pay
and,
attention.
oh yes, I'm sorry, Mel will do roll call. Mrs. Krantz.
Here.
Mr. Heisey.
Here.
Mr. Tim.
Here.
Mr. Cap.
Here.
Mr. Eckstein.
Here.
Mr. Wedding.
Here.
Mrs. Colletta. Here. Mr. King.
Here.
Mr. Waddle.
Here.
Mr. Rothermel.
Here.
Mr. Kirschner.
Yes.
All present. All right, we'll stand for silent prayer and pledge of allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I would ask for a motion to approve the agenda.
I so move.
Motion by Weddy, second by Cap. All in favor?
Aye.
Aye.
Opposed, same sign. All right, well, I need an approval of the minutes of the April 18th, 2017 monthly meeting. Motion by Cap. Second by Tim. Okay, are there any questions or comments? Hearing none, all in favor?
Aye.
Opposed, same sign. All right, we have public comments next, and the first person that would like to address the board is Brandon Bonfiglio. Yes.
Good evening, ladies and gentlemen. I'm Brandon Bonfiglio, and I'm here on behalf of the Waushara County ATV Association. The WCATVA is a nonprofit organization with a pending 501c7 tax-exempt designation. I'm here tonight to form a partnership with the County Board for greater recreational opportunities for county residents and to reinvigorate our tourism industry. In a recent study, it was found that Waushara County's tourism revenue increases are 3 times lower than the state average, putting us in the bottom 10 of Wisconsin's 72 counties and barely keeping pace with inflation. Where this issue is most evident is within our employment statistics, which puts our amazing county in the bottom 5 out of 72 Wisconsin counties. Our residents and businesses need help, and they've asked for this alliance to help propel them from low employment statistics towards greater tourism revenue increases. ATVing and UTVing is a safe, family-friendly, and business-oriented recreational activity that draws folks in year-round to patronize our businesses and to partake in all of what Waushara County has to offer. In the past 3 months, our Facebook page has already drawn more followers than the Waushara County Tourism Facebook page, indicating the level of people support and excitement for this opportunity. On average, more than 12,000 people interact with the page on a weekly basis. In the last week alone, nearly $3,000 of donations came in for the purchase of route signs on newly opened routes in 2 villages and 3 towns throughout the county, with many more pending votes in the coming months. People who travel to Waushara County won't just ride ATVs and UTVs. They'll fuel up, shop for groceries, shop for souvenirs, hunt, fish, and spend money along the way. We want to convert the excitement that we've generated for our stated purpose into excitement and revenue for all of Waushara County's businesses and recreational entities. To help define the process for which county roads are designated as routes, we're proposing a draft ordinance which outlines guidelines for the formation of a route, hours of operation, age limits, and speed. These routes generally serve only as a connecting route between town roads already designated as a route, or to move ATV, UTV traffic from a more traveled town road onto a lesser traveled county road, such as County XX in the town of Aurora, at their request. The Highway Commissioner is the first stop for a proposed route per this ordinance, but ultimately, you and the board hold the key to increased economic opportunities in our county. After canvassing the area over the past few months, the people of this county have repeatedly asked that we form this partnership so that we can begin the economic healing process. On the business side, we have received written pledges of support from grocery store owners, campgrounds, restaurants, auto repair shops, and even a salon owner. Residents from each town and village show up to support local ordinances every time we are scheduled to speak. Each and every one of you has made an enormous effort to make our county successful, and we simply want to help where we can. As newly minted partners, I ask that we be placed on the agenda for next month so that you may consider and act on the ordinance before you. On behalf of the residents of Waushara County and the Waushara County ATV Association, thank you for your time, and we look forward to the work to be done in the coming month. Thank you very much.
Okay, next we have Alexis, is that Gentas or Gentas? Anyway, Alexis. What is your last name? Tempest, okay, thank you.
I'm here because of ordinance 612, for the rezoning in Plainfield. I believe you've seen all the documentation. It's been passed around to all members, okay? So I'm just here to support it. I'm here to encourage you to allow this rezoning. We've been in business in Plainfield for 35 years, and now we are selling. And if the sale goes through and the zoning goes through, the sale can go through for rezoning for light manufacturing. So again, a business in Waushara County. This business, the future business owner is present, if that need be. He's here, but he is going to increase the amount of employees. We've always had 8, and he hopes to, in 2 to 3 years, go up to 35. So it's only good for Waushara County. And the acreage there and the septic system there all has been approved.
Thank you very much. All right, we have no unfinished business. We'll move on to new business. And the first report will be the Waushara County Historical Society and Museum Annual Report. President Marv Wagner Jr. and Curator Treasurer Bruce Reynolds.
Well, good evening. Marv Wagner, President. Bruce can't be here tonight. He's teaching a kid how to play the violin, I guess. So that's the way it goes. Anyway, the annual report is basically to tell you what we're doing across the street over here at the museum. We had 280 visitors that signed in. We don't know how many people actually came through there. We encourage them to sign in, but that doesn't mean they necessarily do. But there were 280 that signed in. On top of that, we had 160 people that we served as research people. People looking for their lost relatives, where they're buried, how many years ago they were in Waushara County, if they were in Waushara County, and approximately 160. As far as the building goes over there, we've had to make some changes up in the attic. We were requested to take care of the attic. We've moved out of the attic because it's a fire hazard and there's no escaping it. If there would be a fire for some reason, there were things that we were displaying up there. We can't do that anymore, so we moved out. And we kind of stripped it out so that there's less of a chance of a fire hazard up in the attic. That's the third story of the jail, by the way. We did put railings on both sides of the stairways up there, and just in case people have to go up there for whatever reason, at least it's safe. We did a bunch of painting in the rec room and the upstairs hallway in the jail. Basement windows have also been glazed, painted, and we put screens on this year, replaced them. The roof has to be redone completely, and that'll have to be wait another year. We had a roofer looking at it, and he said we can get along with it for another year. We had some wind that took a couple of shingles off, and it's getting to the point where, you know, the shingles, when they start to curl, it's about time. So anyway, that'll be done next year. In the meantime, we have to do some sealing on the front part of the jail museum. There's part of that is a tin roof, and it has been leaking periodically. So we're going to take some rubber mobile home coating and coat that whole steel part of it, which it isn't a huge area, but it's got to be done. We've been organizing the archives. If those of you that ever been in the museum over there, if you notice down in the basement, the one end where the furnace was is solid concrete, roof, walls, everything. That's our archive room. Anything that we can't afford to get destroyed by fire goes into that. It's got a fire door on it, and anything that's of value to you, to anybody, is welcome to come, and we'll put it in there and store it. We have to reorganize because it's getting a little bit tight in there. All the pictures are in there. All the glass negatives from Waushara County are stored down there. And believe me, I think we have a couple of ton of glass negatives in there. When they gathered them up from Plainfield and most of the Hancock ones and Watoma, they ended up down in the archive room. We have volunteers there all the time. They come, they're with the W-2 program. The Forward Services brings people down there. They learn filing, they learn clerical skills, and I would guess most of the time they learn how to just come to work. And they've been doing well. We've got 7 full-time. In other words, they come regularly when we're open. 5 part-time that come there at least once a week. 17 of them have, if you want to call it, graduated and gone on to get employment in Waushara County. A little while ago, we had what we called our history night. We had Howard Dutcher, Neil Olson, Mike Egan, and we had pretty well attended. It was down in the demonstration room. We always got to talk about Ed Gein. He comes up all the time, and went around and around about that again. And Howard Dutcher told the story, what he remembered of it. He was a young man, you know, in college about the time that was all going on. And since his dad had just previously been sheriff, he knew about as much about it as anything. The other thing we talked about was the fact that Waushara County was a prisoner of war camp during World War II for German soldiers. They actually didn't camp in Waushara County. They camped in Green Lake and Marquette and some of the other counties south of us, but they came up here and stayed at the fairgrounds. I don't know if any of you knew that, but above the chicken coop, that wasn't only for 4-H kids, you guys. That's where they kept the World War II, the Germans that were here for the duration. They helped harvest mostly beans and the wheat crops and stuff that were in the county and Portage County. So anyway, that was discussed. A lot of people just loved to talk about that, especially the older ones. My dad loves to discuss that because they did help out on our farm with white beans. So I'm still doing the history of Waushara County talks periodically. If anybody has a church group or any group at all that wants a half an hour to hour and a half speaker, I will come and tell you how Waushara County got to be where they are. Okay? It's a fairly interesting story. You know, nobody knows that we were part of Brown County, and then we were part of Marquette County, and then eventually what I handed out to you, which I'll talk about in a minute, that is the original county board meeting and bits and pieces of the first book. Now, I brought that book in here when I was on the county board and gave you guys the report. I showed it to you. We've still got the book over in the museum. But this was basically what started everything. You notice that the Waushara County was called a township at first, and we might as well go through that sheet if you want to take a look at it quick, and then you can digest it at home. But Waushara County was a township only because the people in Waushara County could only live in the area south of the Fox River down by Berlin. which didn't make for a very big county. That's just a little triangle down there north of Waushara Street, and that was the whole county, and they named it a township, mainly because they didn't know if it was ever going to be a county. At that time, it was still part of Marquette County. But, so anyway, they started out with that. And if you take a look at the upper corner here, that was the original layout of Waushara County. Now, if you look at it, yes, they did lay it out upside down, and I corrected it and put it right side up. But you'll see that there was only 4 townships in the whole county. The whole west, more than half, well, a little less than half of the county was the town of Wautoma originally. Of course, the town of Waushara was down there by the town was Sacramento, and the town of Marion was the town of Marion. It still is the town of Marion, only it got made a lot smaller. And then Mount Morristown, Leon, all that up there on the northern side, that was the town of Ontario. Those names were brought up the very first night that they had the county board meeting. If you'll notice that when Waushara County was born, it was April Fool's Day, 1851. I always get a kick out of telling people that. They seem like that. If you have any questions about that, you can ask me some other time or tonight. But that's basically the beginning of the town or of Waushara County. I just want to remind you of a couple of things that are history related for Waushara County. There's an antique tractor show going on June 9th, 10th, and 11th up in Plainfield. You guys are certainly welcome to come to that. We have a little bit to do with, the museum has a little bit to do with that, although that is the Tri-County Thrasherman, tractor show. But don't forget, June 9th, 10th, and 11th, we are having a Historical Society meeting Thursday of this week at 1 o'clock. You're more than welcome to show up if you want to. We're going to start out the meeting over at Lakeshore Family Restaurant. At 1 o'clock, you can come there and get a bite to eat and sit in on our meeting if you'd like. The museum is open Wednesdays for research or for tours or whatever you want to come. If you want to come take a look, come on Wednesday. And the dairy breakfast. We have nothing to do with the dairy breakfast, but I'm going to mention it because it's June 25th, and it's going to be at the Hancock Experiment Station this year. Okay, that's it. I think I've taken enough time. Any questions?
Have any questions?
What's your hours on Wednesday, Mark?
When? Normally 9? 9 to 5? 9 to 4. Okay?
Barb, do you have any plans for fundraisers, to get your roof done?
Well, yeah, obviously we got to have a fundraiser, but we've got some money committed. There's some people that have already, since they've heard about it through the grapevine, I don't think we're going to have any trouble. It cost $12,000 the first time. 21 years ago, it was $12,000, and we believe we can get underneath that because, as I understand it, we don't have to remove this roof. There's one layer on there. We can just lay a new layer over the top of it. And we got to double check and find out. We would like to go, if we could have the money, we'd like to put a steel roof on there, but being that that's a registered building, we don't know if we can do it.
I was going to say,
Although I've been told that we probably can because they prefer buildings surviving than being architecturally correct. You know what I mean? But that would have to be a decision from higher up, I guess. Okay?
is that a lot more expensive than a regular roof? I don't know.
Probably in the neighborhood of 16 to 18,000 instead of 10. Yeah, but I won't have to worry about it anymore. Shoot, 20 years, I won't have to worry about the asphalt roof anymore. So, any questions? If not, thank you very much for your time. You're welcome to come over any Wednesday and give the girls here a hard time, okay? All right, thank you very much.
Where's my dollar?
What's that?
Where's my dollar?
That was paid the first year.
Oh, okay.
Okay, otherwise, I did check on it, but Bruce said he had already paid it, so I couldn't bring you $1. Okay?
Thank you.
If you don't mind, I'd like to be excused, but appreciate the time, all right?
Thank you. Next, we have the Department of Aging Annual Report.
Hello.
Hello.
How are you?
How are you?
Good, thank you. This month is Older Americans Month. The theme is Age Out Loud, so I give everyone permission, no matter what age you are in this room tonight, to age out loud between now and the end of the month, whatever that means to you. So it's a good time for me to come and do my 2016 annual report. I did provide you a handout. I am not going to go through everything that's on there, but I will hit some highlights. The Department of Aging typically serves about 3,000 people a year, and that's unduplicated individuals. When we collect our data, we do a lot of grouping, and we have separate databases, so it is really hard to get an exact number. So I really anticipate that's actually a little bit higher than that, but we always say we do about 3,000 a year. So that's between 200 to 400 a day. We are serving, obviously, a little bit more females than males, which is typical, and 35% of who we serve live alone. What's interesting for me, too, is when you look at the age breakout there, 24% of who we served is 85 years of age or older. And a little piece of trivia, and you can use this if you have coffee with anyone tomorrow and need some trivia questions. In 2017, so where we are now, this is the first time ever in history that more people will be 65 and older than we will have children 5 and under. So, and that's worldwide. So we are part of history this year. So meals, we served 43,000 meals. That was actually up a little bit from last year. What was different this year or in 2016 for us is that we actually, two things. One, we added meal choice to the menu every day, Monday through Friday. So now if you go to one of our senior dining centers, you have a choice of 2 meals. We have not rolled that out yet to home delivered meals. We are hoping to do that perhaps this year or else early 2018. That was part of a revitalization project with funding that was provided from the state. And the reason they provided us that funding was to try to determine if choice would make a difference with people coming to senior dining centers, because less and less people are coming statewide to senior dining centers. And we just concluded our 1 year, our 12-month period. So we will look at those numbers a little bit more, and I can report back later. But I can tell you from the sort of the half a year mark, it did not look like we were bringing any new people in, maybe just a handful because of choice, but we were having people cancel less frequently because they didn't like something that was on the menu. So overall customer satisfaction is higher, and they're having better, their preferences are met more frequently, but not necessarily bringing new people in. But we'll see what the full year's worth of data shows when we're done. Trip-wise, we actually provided a fewer less trips than we did in 2015, and that was mainly due to a managed care organization change in their policy. We'll see if that continues and track that carefully to see if we can make any changes related to nutrition. In the middle of the handout, nearly 11,000 contacts came to our regional ADRC, our Aging and Disability Resource Center, of which 3,700 were at the Waushara County Resource Center. So they are a busy place. It's going to be just over 2,000 unduplicated people that would have contacted the ADRC, and you can tell then that they've contacted it more than once, which is usually a good sign that they were satisfied the first time. So at least hopefully that's what it means. Through the ADRC, and again, that's a partnered effort with Adams, Marquette, Green Lake counties, as well as Waushara County Human Services. We also offer evidence-based health promotion programs. And our primary programs there are Stepping On, which is a fall prevention program, Living Well with Chronic Conditions, Living Well with Diabetes. And we were able to bring back Tai Chi, which is extremely popular with our group right now. Just brought it back in 2016. And now, right now, we're actually partnering with UW-Madison to, as part of research for a program, and I just have to say this because it's fun. Okay, ready? It is called Mind Over Matter, Healthy Bowels, Healthy Bladder. And I'm not looking at you for any reason, though. Primarily for women, and these women who are participating in the program, some are in a random study, and some are actually taking the class, and so it'll be interesting to see at the end how that turns out. I think it's exciting for people to have that opportunity to be a part of something like that. So we actually did some memory screens through our ADRC in 2016. That was the first time we've tried that in a while. In fact, I think it might be the first time we've ever tried it. And we weren't really sure if people would respond. You know, do they really want to come and see how they're doing with their memory? But we had 10 people who signed up. We only offered it once. And it's a really good way to get a baseline of where you're at today. And then in case you start to notice changes and want to do something about that, you know, it's just a good idea. Caregiver support continues to be a huge demand in the office, and I don't see that changing anytime soon. In 2016, we're very excited to set up what we call a self-directed volunteer team, and they are working on putting together memory care cafes, which they're planning to pilot in Waushara County in August. So we're excited about that. And then you probably saw it over and over again. It was highlighted pretty strongly in 2016. The Aging Mastery Program is something that we partnered with UW Extension on, and we were awarded a grant to provide that class series in Waushara County. We were one of, I can't remember, it was 11 or 13 agencies in the state to receive that grant, so we were excited about that. And that program is 10 classes that talk about financial fitness, exercise, nutrition, sleep, healthy relationships, and of course the most popular class, advanced planning, that Ruth Zowski was the leader of. So, had to get that one in there. Our volunteers are truly one of the most valuable parts of the department. We have 191 registered volunteers, and they provide a lot of hours of service to us at a monetary value, as you can see, of $167,000. So without them, we would be needing a lot more money to do what we do. So we're very appreciative of the volunteers. And in fact, we're having a breakfast for them on Friday and a little training that will go along with that. On the back side of the handout, it points out what our budget was for, or what our actual expenses were in 2016. And you can see that 29% of that total is from county levy. So the total is just over $1 million. And 29% comes from county levy. The rest of it is either grants or program income or donation money. And I will say that I was excited to get that underneath the 30% because, you know, it's been 33, 34, and I've been trying to get it down. It was close to 30, and now we went to 29, so I was pretty excited about that. So I've already mentioned the majority of the highlights for the year of 2016, I believe. And just some things, other things that I didn't mention for 2017 and I guess beyond. We continue to work on the business acumen, which I think I've mentioned here before, which is especially I think for nutrition and transportation, learning how to think more like a business, how to not just give all of our programs away for free. And it's a bit of a shift. I mean, it's going to take a little while to get where we need to really be with that, but we're working on it. Aging and ADRC integration is something that is being talked about at the state and encouraged. They're encouraging ADRCs and aging units when they're separate to combine as a governance, as you know, as well as their budgets. That is something that we've had, you know, just 1 or 2 meetings here locally with Human Services, myself, and our ADRC director. We'll continue to have those conversations and at some point maybe talk more formally about that. There are some reasons why there's a delay perhaps in that process that I can get into if you're really interested in, but the bottom line is it would potentially prevent us from bringing in some money that we're currently getting right now, so that's why we're kind of taking our time until the state gives us an answer on a question that we all have. And then because we do so much with regional work and partnering, in fact, this summer we're going to be bringing on an outreach specialist for work with in the area of dementia. Obviously, our ADRC staff that come in and out. We are looking at maybe taking one of our offices and making it into more of a mobile office station area where people that don't need an office 5 days a week can come and just maybe, you know, log onto the computer and do some work if they're here 1 or 2 days a week. we're in the process of getting some estimates on that and some designs. Haven't gotten too far with the process, but we do have some designs at this point, and take a look at that and we'll see what the cost would be, and perhaps bring it back. So that's pretty much what I have for the year 2016. And I just want to say, just really quickly, really proud of my staff. I have a very hardworking department. They're very, very loyal, very hardworking group, and from site managers to kitchen staff to people in the office. So just wanted to give them, I guess, a shout out. And with that, if you have any questions or comments.
Looking at me when you talked about dementia.
I'm so sorry. I'm in trouble.
I'd rather have dementia.
No. Yeah. Hi, Everett.
Is the federal budget going to affect?
Does anybody have the crystal ball for that one? Yeah. Are you? We don't know. Obviously, there's a continuing resolution right now to keep the government open. So, and that's through September. There is some effort right now to get an increase in the Older Americans Act funding. So we're hoping that that will come to pass. I know there was concern, a lot of news about home-delivered meals, and that is a true legitimate concern for a lot of states, but in the state of Wisconsin, that particular funding source that they were talking about, the state of Wisconsin does not use for home-delivered meals. So, but it doesn't mean that other people nationwide wouldn't be affected if that does, in fact, go through the way that it's been proposed. So there is some definite concern out there, and I don't know how to determine what the answer will be to that. So yeah.
Concerned about that part of it.
Yes. Thank you. Yeah. Any other questions?
You have another aging mastery program starting up, don't you?
We will have one starting at the end of August, beginning of September. We have completed the terms of the grant, and we just have to do one sustainability type class is what they're calling it. And then after that, we should be able to continue the program once or twice a year, depending on demand, I guess.
I think people, at least the people that I talked to, really enjoyed the class, and they've learned a lot.
Yeah, it has been extremely popular, and really the neatest thing about it is, of course, we do surveys, and the surveys have all been very high, but also they have to state on there if they've had any behavior change, and almost every single survey, there's multiple items written of positive behavior change because of taking the Aging Mastery program. So, and some of the speakers who have been there, they've said, I want to stay for all of the classes myself, because they're interested in what else is offered. So it's kind of exciting. Yeah. Yeah, hopefully you'll enroll one of these days, Donna. All right, thank you very much.
There's one that's in a category. I want to thank you for what you're doing.
Oh, thank you so much. That's really nice. Appreciate it.
Okay, next we have the Public Health Department Annual Report.
Good evening. You guys have heard from me so many years. We're making it quick tonight. So we just did a little summary. Of course, this special request of Mr. Kirschner that I always be quick. So anyway, 2016 Public Health Department. So staffing-wise, my department has 14 full-time people. We have a part-time hygienist. We have a part-time employees that are doing our adolescent health grant. So we have, once again, like Deb said, we hire terrific people. So we're funded by a combination of things. We have county levy. We have personal contracts that we do. We have funds from grants from state and federal. Most of our things are federal. Our contracted services, along with doing what we're supposed to do out of the 9 essential services, we do things that are required of FAB, which is our accreditation group nationwide. We became accredited in 2016. We had our site visit in March, and we were officially accredited in September. We'll be accredited for 5 years. We just have to do an updated report every year to maintain that accreditation. We are the first county in the Northeast region to be accredited. The second one is Shawano, and they were just accredited. So we're amongst some like 13 or 14 counties in the state so far. And Wisconsin is running ahead of a lot of other places. So what do? A couple of special things. We always have to provide a community health assessment every 5 years, and we completed that in 2016. So you can see just a copy of what the publication looks like. I believe we discussed that in another meeting. And with that, we look at all the data, and we look at personal opinions of people to say what are the issues and concerns health-wise in Waushara County. And then we follow that up with a plan, and that's being done this year in 2017. So other things that we do, communicable disease monitoring. We gave you a list of the number of investigations. We have to look at everything that comes through our door. Some things take more than other things do. This is one of those things that are mandated, and we are given no money for this one. However, this year, our board did sign on to the resolution to send it to the State Department of Wisconsin to ask for funding for communicable disease, and it's actually moving forward slowly. Doesn't mean we'll get it. Hopes are high, but it would be the first time the state actually doled out some money out of its own little pocket, so we'll see if that happens. Car seat program, we've been doing this for a lot of years. I have staff that probably do 100 or more every year. We have 3 or 4 people that are technicians, and you'd think that was pretty simple, but they have to learn how to do every single car seat that exists out there and every car that exists out there. So it takes a lot to learn it, and it takes a lot to redo it every year and continue to do that to keep our kids safe, which is our important thing. Shots we're probably most known for. A lot of people come and get their flu shots with us, their regular children's shots, and their pneumonia shots. This last year was a real big one for pneumonia shots because they added a new one. So, of course, every time they add something, everybody has to catch up to that. So it benefits us because we do make a little bit of money on those. So that's nice. And we do bill for other immunizations. So our environmental program, I think a lot of you are pretty familiar with our environmental program. We are the fiscal agent for 3 counties. We have always done human health hazards for a long time. That's when things look nasty, and you're like, let's see if we can fix that. And then we started doing the food program in 2006. So the recreational food program is not only restaurants, but it's also grocery stores, it's campgrounds, it's tourist rooming homes, and people rent out their homes for other people. And I have 3 staff, 1 in each county. They partner over all 3 counties, and they do a terrific job. We don't always make friends with this program because it is regulatory. It's telling people this is what has to happen. And sometimes they have to spend a little money to fix things up, but it certainly keeps people very healthy in more ways than one. Radon testing, we do some quality improvement programs, and with radon, we wanted to get the word out more, and we wanted to figure out how to get more kits out for people to test their radon. And we accomplished that. As you see by the chart that's in the upper right-hand corner of page number 3, that shows you the increase in what's happened over the years with the radon kits getting out. And one way that we found it was really useful is during tax time, along with tax time and voting. And so there was a lot of voting this year, so got a lot of radon kits out there. We already talked a little bit about the food program, but you can see how many facilities are licensed, and this is just Waushara County. For the 3 counties, we do almost 1,000, but Waushara, you can see how many inspections were done. It's a lot of work for one person to do. Adolescent Health Grant, we were really excited to get that. The bad side of that was we got it because we occasionally have a high pregnancy rate in teenagers, and so they were like, well, let's help you do something about that. And it's programs that are evidence-based that we've done. The schools and the communities have really stepped forward and been real excited about this program. And I have 2 staff who are just so enthusiastic and do a wonderful job. And it may take a long time to get some outcomes to show from that, but we've been real excited about what's happened. It's things like family supports, getting families communicating better together. It's good dating choices and learning how to be safer on your dates and learn probably to say the word no once in a while. Foot care, everybody knows how popular foot care is. So we gave you some of the numbers for that. We have such a high demand, and the nursing home that was doing this temporarily stopped doing it for a while, and boy, that got people running in the door. But I only have one person who does it, and so we only have so many slots, and we do the best we can with what we have. Drug disposal. A lot of people know that the opioids and other prescription drugs is a huge issue. It's not going away. One of the evidence-based programs is they say get those off the street. So we do that twice a year. Between the Sheriff's Department, us, Human Services, we pull as many as off as we can, and sometimes it's hundreds of pounds. You can see on the chart bottom far left on page 3 how many pounds that we've done. And the last page, guys, tobacco compliance checks. We've been doing these for quite a while. So we send out a child who is underage, should not be able to buy. We send them in, and unfortunately, I have to say, we've been getting more sales than not in the last couple of years. So we got some work to do there. What we did recently is we took some of the money that we've been donated by one of the municipalities and put some ads in the paper to thank the tobacco sellers for trying to help out, that they're a key to this. And so we're doing our best in a positive manner to try to get people to train their employees better and make sure that they know that they're underage and they can't get the cigarettes. School health programs, I have 3 nurses, 1 in each one of the school systems. It's very important. I have 1 that's full-time and 2 that are very part-time. You know, your youth's health is one of the biggest deals with trying to make sure that our youth do better. We have so many kids on meds. We have so many kids with issues. It's more difficult every year. Hearing and vision, children's varnish, dental, sealants in the schools, migrant health. We used to be a really big program for us. Now La Clinica took part of that over. And we do the tail end. Whatever they can't manage to do, we pick up at the end of the year. But it's one way we can work with our Hispanic population. And we continue to do prenatal care coordination, which is working with moms who are at high risk of having babies early or small and trying to make sure that they get a good start. It also helps our MA rates because they're the ones that end up paying for a lot of that if not. You can see some of the statistics about the Well Women's Program, which helps with breast cancer and cervical cancer and getting the people that fall between the cracks. Even with the Affordable Care Act, we still have people who don't have insurance unless somebody helps them out with special programs. And last but not least, you see the birth statistics at the very bottom corner there. It does unfortunately tell you that we have a few moms that are pregnant that like to smoke. So obviously high teen rate and moms that like to smoke when they're pregnant. We got some work to do. A lot of it's about lifestyle change. So that's a quick run through. Anybody got any specific questions for me? Oh, Deb does.
I have a couple of questions.
All right.
So on the communicable disease, that very last one,
Ehrlichiosis.
What is that?
It's another one of those tick things. There's anaplasmosis, ehrlichiosis, and Lyme's are all out of tick stuff. And their theory somewhat is, too, that we do have a high Lyme's rate. I mean, it's been moving to the west, and we've had a high Lyme's rate for a long time. But they really think some of those Lyme's diseases probably were ehrlichiosis or anaplasmosis. And it's just that people didn't think about that at that point. Now they think about it more, and it's more inclusive in the panel, and so we're catching a lot of those. So those ticks are nasty, and I know that I don't think they died this winter. They're out there, so.
Yeah, the drug take back,
Mm-hmm.
you know, when you think of the amount of pills. I know to get them off the street is important, but are they doing anything to get doctors to not prescribe so readily?
There's been a couple of webinars that the state has done trying to get them to listen to prescription processes, and there's a prescription drug monitoring system that they now are required to use. So if somebody comes in for a prescription drug that's in a certain category, they have to actually look that up first, because a lot of people used to doctor shop. You know, they'd go, okay, I'm going to go here and get this and here and this and get this, and now those would be found on there. It's still listed that's probably one of the bigger things. And I know myself just from general prescriptions, and now even for ourselves, for the county, you get them through the mail. Everything's 90 days. So every once in a while, we will find that someone probably got a new drug, it didn't work, or they didn't like it in the first 5 days. Well, where do you think the rest of those just went? So it's really going to depend. Also, when it comes to like opioids and pain meds, the latest literature is saying, you know, we got to stop. We got to stop even ordering a lot of that stuff. And when you go and get, you know, some type of surgery or maybe dental work, and you get 10 days worth, and you take 2, right? And the rest of them are sitting there for somebody. So a lot of these that we even get off the street aren't always even, you know, there's some in there that people would love to sell, but a lot of it is just period getting drugs out. That's more environmental, so they don't get thrown down toilets and, you know, in the waste and make a big difference. But the ones that everybody, of course, wants, there's not as many of those. But we hope we're doing some good. It is one of the things that are listed. There's only about a handful of things that are listed for opioids and drug things, you know, and one of them is getting them off the street. Other ones are medically assisted therapy, and we're just right now looking at a really small grant to try to work on that. It's not something we do for the county, but it's something we can try to work on other people to do. And yes, there's other stuff about talk to your physicians, work on that prescription drug monitoring thing, and try to change behavior. And we know that with a lot of these other things, change behaviors, it's very individual. I can't make you do it. I can only educate you.
Last question.
Okay.
I've been seeing these boxes in different locations, and it's for collecting diapers for babies. And it says 1 in 3 mothers can't afford diapers for their children. Are they, I just noticed this percent on WIC, is that kind of where they're getting that statistic, or?
It may be, because I wasn't aware of that statistic, but I'll tell you, the people that we see for prenatal care, those that we see, they are looking for more than education. They're looking for things. I think WIC sometimes has trouble keeping their numbers up, and sometimes it just depends on what people are willing to do. But I don't think the need is not there. I think it's what people are willing to do for what they get. But we do have people that are very used to coming in and saying, you know, I don't have milk, I don't have diapers, I don't have formula. Items are trouble. And that's not necessarily something we do much of.
So is public health one of the distributions for that, or is it all?
It's got to be somebody else. It may be a pantry. I know those pantries do a pretty good job in Washera County. Yes, Everett.
That's where
Yeah.
we have one in our church, and
That's just an excellent thing. Yeah. The poverty level. We know that our demographics are pretty.
Okay.
Anything else? Thank you for your time tonight. Always good to see you.
Thanks, Patty.
Thank you, Patty.
I always enjoy going over to the health department to get my shots, my flu shots. Patty takes very good care of me. Yes, yes, you do. Okay, thank you. All right, next, we have discussion and possible motion action items. The first is approval of the updated hearing conservation program, and I think Deb is gonna.
Sure, I can. So basically, we've had this in place since 1994, but we need to update it from time to time. And so the references from administrative coordinator have been changed to administrator. And then the other big change is that we're more specific in the positions. So in 94, the sheriff's deputies were in, and then in 2006, they were taken back out. Well, now they're back in, and the reason that the sheriff's deputies have been identified is because of their target practice and handling guns. And so we've also added that we'll bring a mobile audiometric equipment in, and they'll get tested on site. So we had that, I think it was May 9th, Jeff, when we did that. So we had some other training for the sheriff's department, so we got the deputies taken care of right away, as well as the buildings and grounds folks and the parks technicians. So it's basically just updating to meet what's going on in our work world. So the other thing, I guess, is what I would like to do is just incorporate this into our personnel policy instead of having it a separate standalone. We incorporated the bloodborne pathogen last time, and I'd like to just incorporate this into our regular personnel policy.
Make a motion to approve.
Ready?
Second.
Second by Wado. I almost didn't know his name.
I know.
We
I was
haven't
wondering
seen
his
him in
name
so
so
long.
long. Yeah.
Now, this motion is for the approval of the updated hearing conservation program well as adding it to the
Correct.
personnel policy. Okay, we have a motion and a second. Do we have any questions or comments concerning the policy? All in favor?
Aye.
Opposed? Okay, next we have approval of the county capital improvement plan.
Yeah, please. So the county is contracting with Mike Konechny. He's a former auditor, and so he's trying to put some policies into place. So we had the uniform grant guidelines a couple months ago. This one is the capital improvement plan. I think if you would have asked any department head over the last 5 years, they would have been able to tell you on the top of their head what they needed to have done and what year and how many years out, and so they always had it informally. This is to formalize that plan, so it's a better planning tool for budgeting purposes. I did distribute just a single page. This would incorporate into the page 3 the funding source. After we got this to mail like hot off the press from Mike Konechny, and then the department heads met and talked about it and really reviewed it. And there was one typo. Instead of tax lay, it should be tax levy. So I just wanted to show you that one small little tiny change. So basically, it just formalizes the process of capital improvements. There's a form that the departments would send out or would fill out and send back to the county clerk's office and eventually the administrator. And as everything gets compiled, then it comes back to the county board. And it basically gives you a 5-year plan. So it kind of levels off the budgeting needs for over those 5 years, so you don't have spikes and peaks and valleys. It just levels that all off. And it just formalizes basically something we've done informally for a long time.
We have a motion. Motion by Pat, second by Bernadette. Are there any questions or comments about the plan?
When are we gonna get some numbers in it?
This is, now that you've adopted it, this will go, the form itself will go to the department heads. And I believe that it comes to executive, I can't remember if it was June or July, but I think it comes back to you guys by July. So you'll see the completed compilation of all of this. So many of the departments will never use this tool, but your bigger departments, buildings and grounds definitely is going to, sheriff's is going to, highways going to, parks will need to. So it's bigger equipment, it's things of more substance. So, but you'll see the compilation of it in July probably.
Any other questions? Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Thank you. All right, next we have ordinance number 612. Ordinance amending Sheriff County zoning maps pursuant to the authority granted in Chapter 58 of Sheriff County Code, zone change, Complete Air Systems Incorporated in the town of Plainfield. Motion by Kirschner to approve, second by Rothermel. Are there any questions or comments concerning this?
I have a question. What exactly does Complete Air Systems do?
Dan Nered with Complete Air Systems. What we do is we manufacture high-efficiency HVAC equipment, specifically DOAS, direct outdoor air systems, cascading refrigerant heat pumps. We've got about 20 years track record in parsing these units together using pre-labeled equipment like Trane and Greenheck, and now we're putting together our own assemblies for the last 2 years, and marketing is very well and sales have been very well, and we're looking for a facility to build these units wholesale and get them out there in the street and then market. Sure.
We have a motion and a second. All in favor?
Aye.
Opposed, same sign. Okay, next we have Transportation Coordinating Committee. The first one is Roger Charette. questions or comments? All in favor?
Aye.
Opposed, same sign. We have some proclamations. First one is designating May 2017 Older Americans Month. You want to take these all together, or?
That's okay with me. It's
Okay.
okay with you.
And then the next one is designating May 2017 Aging and Disability Resource Center Month. And the third one is designating June 15th, 2017 as Elder Abuse Awareness Day. We have a motion by Eckstein, second by Bernadette. All in favor?
Aye.
Opposed, same sign. I would like you all to, I hope that working with your tablets is coming along better. Barry, at the request of Ruth and Deb, is putting an email address for you on the tablets so that you, I know, Larry, you're having trouble with yours right now, but I think Barry will be working with you on that. But having your email, Everett has his, Pat and Dennis and I, and it's a whole lot easier than having to, you know, take your computer out. I mean, you could check it daily if you want. And so if you could stop in and see Barry, you can put your email right on your tablet.
He's never around when I want to do it. I can never catch him. I think I've been there 4 times this last week, and
We'll have him call you and make an appointment. How's that?
When are you going to be at the courthouse again? Let me know.
After this week, because he's gone.
Yeah, he's gone right now. So, but yeah, he was on vacation last week.
Do tomorrow.
Of May 25th? Okay, I'll just,
30th is what?
May 30th.
okay.
Hi,
May
it's in there.
25th. It is the 30th? You
Yes.
sure? Or did I get the 25th? I guess my calendar is last month's yet.
What time is that meeting at, Dawn?
9.
9? Do you want to stop in after then, Bernadette? I'll just
Okay.
tell him to be around that day. Okay.
Painless.
Yeah, it's very quick, and it's a lot easier to check your emails on your tablet, and then it keeps Ruth happy too.
One comment about that, when your email is in the machine here itself, it tends to go to sleep easy. So you just have to swipe it every few minutes or something like that to keep it awake.
Keep your thumb on it too, on the screen. That
Kind of
is-
like what my wife has to do to me.
Yeah, right,
Nice.
yeah, it is a lot easier, I think, to get your email on the tablet. So, and then, like I said, it's always in our best interest to keep Ruth happy. Really?
Yes.
Okay. What? Thanks. Okay, we need a motion to adjourn. Everett, second by Larry. All in favor?
Aye.
Same sign. We are adjourned.
Yep.
No, you just shut it, it shuts off.
Donna,
Yes.
liable to be on our next month's agenda.
What?
Power off, okay?
I don't know. I guess.
Oh, one of your committees should take
Shutting down.
public works.
I got, I might get the hang of this yet before I.
Yeah, you're right.
Also,
Clear.
yeah, also,